So this is for all those people who are planning to get married, or planning to have intercourse for the first time, or getting exposed to an intercourse for the first time, and have the fear of what it's going to be like, because there's a lot of fear surrounding this, that it is a very painful procedure, and with the thought of it, a lot of women get scared and start developing something called as vaginismus. So let me tell you that it's not as scary as you think it is. So first time when you are having intercourse, the pain is only because there is a small piece of tissue at the mouth of the vagina, which is a protective layer, and that is what kind of separates or tears when there is a intercourse for the first time. And there is a little bit of spotting, which is normal. Spotting of blood, bleeding, which is very normal when you are having an intercourse for the first time. There is nothing to fear about it. So for first time, people with first time intercourse, we usually advise all of you all to, if there is a lot of dryness or pain, we use some local anesthetics, or we use lubricating jelly to cause much less amount of pain as possible, and let this process of intercourse be as smooth as possible. But if in spite of all this you're still having pain, then you must visit the gynecologist, who will have an examination and see whether your hymen, which is that thin layer which is of tissue which is covering the mouth of the uterus, is intact, and is it very tough that it is preventing you to have a painless intercourse. In such cases, you might require a small procedure called as hymenectomy. So if you are having very painful intercourse, or are not able to have intercourse in spite of using lubricating jelly or any local anesthetic jelly, then you must visit the gynecologist, who can examine you properly and also be able to make out that maybe you have a very thick hymen which is not being able to open out at the time of intercourse, and probably that is causing so much pain. So we do a hymenectomy. In this procedure, we give a short anesthesia and we cut open the hymen for you instead of having it forcefully broken. And that is a painless procedure because you're doing it under anesthesia. It's a very short procedure, small procedure, and that will open out the vagina for you to have a safe, comfortable intercourse.